Okay, now listen up, anyone who's got blood pressure, even mild blood pressure, even that state which they call pre-hypertension, where you don't have blood pressure, but they like to pretend you're going to get it, so you need medication. If you're taking meds of any kind, or you do have a disposition to blood pressure, I've got something really quite interesting for you, which is an amazing, I'm going to explain it in detail, but an amazing little electronic device that can fix all that. Within 4 to 8 weeks, actually. It works in about 9 out of 10 cases, which is a pretty good hit rate, and will drop your blood pressure anything from 15 points and upwards. In fact, it seems to be one of those things like a rubber band. The more your blood pressure needs to come down, the more it will come down. And it's really quite a fascinating bit of technology, actually, but and I'm going to explain a little bit about it, but it is accredited, it's recognized in orthodox medicine. This is not woo-woo, or it's not so far off the edge of the holistic map that the orthodox doctors are going to fight it. In fact, it's very orthodox. The Harvard Heart Letter says this is great, and repeated that it will work with 9 out of 10 patients and will drop blood pressure anything from 15, 20 points upwards. The Mayo Clinic Health Letter equally, and the International Journal of Hypertension, International Journal of Cardiology have all come out and supported this device. So what's it about? Well, it started as one of those strange observations, actually. It was a Dr. Ronald Wiley working with pilots in the F-16 fighter in the US Air Force. And these were having to make very, very sharp turns and creating huge G-forces. And pilots were actually passing out. So Dr. Wiley had to come up with a solution. Long story short, he found that by gripping tightly, they were able to alter their physiological response so that they didn't get the same blackout effect. That led off in a whole different direction to do with fighter pilots. But the interesting part was that later Dr. Wiley got to look at his data and went through it, and he realized something really quite interesting, which is some of the pilots who'd had very significant blood pressure issues, by doing this fierce gripping technique, had lowered their blood pressure very significantly. And then he wondered if this could have a clinical application. Well, indeed it could, and he was right. And he went on to develop an electronic device like this one. Not this exact one, this is the one I own. It's called the Zona Plus. And I think it's rather cute and rather dandy. It's actually very easy to use. It's based on this gripping technology, strong grip. But I've got to tell you, just grip isn't enough. If you don't grip sufficiently, you won't get any benefit. But you can actually grip too hard and do yourself some damage, so just crushing one of these rubber balls and showing you're a macho strong man, or those grip lever things that supposed to increase your wrist strength and your grip and so on. Not those, okay? It's very important that you distance yourself from those. I'm not talking about those. I'm talking about a balanced and controlled grip. Now, one of the first things that Dr. Wiley realized when he developed this machine was that people vary every day in their grip strength. So one of the very cute things about, let me switch it on and I can show you while I'm talking about it, but one of the very cute things about this device is that it will invite you, it gives you a short 5-second rest look, and then it says squeeze as hard as you can for 2 seconds. So that's exactly what I'm doing, and it tells me to stop, okay? A few seconds of rest, and then it wants me to do the same thing with my left hand. Now, the important point on this is this changes every day, so your sort of baseline strength reading is what counts. But you're then invited to, using the day's test grip, to squeeze as hard as you can and hold it for 2 minutes. And that's exactly what I'm doing now. Now, the squeaking noise, it's telling me I'm squeezing too hard, and this is quite cute. It'll say squeeze harder or squeeze less if you're over or under doing it. So we're in a very narrow window, which is actually quite critical and important. And what you do is hold the right grip for 2 minutes, and then we swap hands, take it on the other side, and so on. There's a little dial fascia here where it shows you which hand you should be using. So when we've done the grip, the grip for my right hand, it'll give me 60 seconds rest, and then the little icon will switch over and say take it in your left hand now. I've got it started, so I'm not sure whether I can keep talking and keep doing this, or whether I should just stop it. But it will probably squeak and beep because it's not very happy with me just leaving it lying there. But anyway, it's really this important point that I'd like to reiterate, which is there's a narrow window which is right and which will produce the physiological effect. This little device, which is called a Zona Plus, by the way, knows what that window is, and if you're squeezing too hard, it'll tell you. If you're not squeezing hard enough, it'll tell you. But it wants you to hold the right grip or a suitable grip for 2 minutes. So it just measures off 120 seconds. At the end, you get a score, by the way. If you score over 80, it means, you know, you're pretty good, you've held to it. My scores typically are 95 plus. It's really not difficult. The machine does all the thinking for you. And honestly, this is really all you have to do is do what the little screen says. And it says, just now, it says squeeze more. Another 18 seconds to go. If I squeeze too hard, it says, oh, squeeze less. And I hold it exactly as the machine requires me to do. For 120 seconds or 2 minutes, then it will give me a minute's break, so I'll talk fast in that 60 seconds. Okay, that's the end of the right hand grip. So we get a 1 minute break between the two, 60 seconds. How can this possibly work? Well, the answer is we don't know, but one of the things for sure is that it increases vagal tone. Now, you've heard me talk about the vagus nerve before, particularly in respect to microcurrent therapy. By stimulating the vagus nerve, you get a very strong relaxation response. It's a sort of calm, chill. It's the eat, sleep, and chill reaction. I've got to look at this now, so still 27 seconds to go. So increasing vagal tone will calm your body, put it into a parasympathetic state. It will slow down your heart rate and relax you metabolically speaking, physiologically speaking, I should say. And it's really like doing 3 hours of yoga in just 10 or 12 minutes, so that's pretty good for most of us. It also, I'm pretty sure, oh, here we go, look, let's start the left-hand grip, okay, it says grab it now, so there we go. Squeeze less, it's saying. I'll try and ignore it without getting beeps and squeaks by doing it wrong. Anyway, it certainly produces a nitric oxide response. Now, nitric oxide, first of all, think Viagra. That's really all Viagra does. It liberates more nitric oxide, so better erection, so better sex. So, listen, fellas, that's another good reason to get one of these. And as I said, it's not a macho thing. It's not squeeze as hard as you can, you know, Clint Eastwood. It's just do what the device tells you. And what you're actually being asked to do is squeeze at about 1/3 of your normal or your fiercest grip. So, you know, this is not very intense, and yet, nevertheless, it works well. Anyway, as I was saying, nitric oxide response, we know that relaxes arteries. In fact, this whole procedure seems to be able to remodel your arteries over time so that they're softer, they're more flexible, and actually more dilated, you know, like a larger diameter of what we call the internal lumen of your arteries, more blood flow, in other words. So there's all sorts of spin-off effects from that, you know, more cerebral blood flow means better brain response, less likelihood of dementia. You know, you hang on to the grey matter that you've got and it performs well. That's what cerebral blood flow is all about feeling good and clear thinking and all those really cool things, which are almost the opposite of taking blood pressure drugs. You just don't need those drugs, okay? They've all got negative side effects. I mean, yes, it can be argued that the side effects are not as bad as dropping dead from blood pressure or a sudden heart attack because you're carrying silent hypertension. Most people do, by the way. It's been called a disease without symptoms. Most people with severe and dangerous hypertension don't even know they've got it. Anyway, this device is just literally totally a brilliant solution. I love it. It's very affordable. It's a rechargeable battery. You charge it up you know, just using an ordinary computer USB, it's a micro USB cable. I've got to change hands, it says go back to your right hand. and it's given me another 60 seconds break. Okay, you get the idea. I think this is something for everybody. If you've got significant hypertension, you really need to get one of these. They're only a few $100. They'll last at least 10 years. It's very well designed and very well engineered, and if you reckon, divide by 10, say, the cost per annum is really pathetically small. And the gains and the benefits are so enormous. It's not just a question of lowering your blood pressure. As I said, there's more erectile function, more cerebral blood flow. That means improved emotions, sharper in mind, and so on. It's a great little beast. So there we go. It's called the Zona Plus. Okay, check it out on this website and get yourself one. I highly recommend it.